We have done a study that was then published in 2009. It was a study in the posterior mandible implant placement with into healed ridges, so they were all healed at least 6 months. A standard implant placement, no bone grafting procedures, and with this as selective surface, we wanted to load these implants at day 21, at 3 weeks. Here you see some of the cases. You see this is a healed ridge in the first molar. You see the implant bed is prepared, the implant is placed. ISQ reading is done, 81, which is very high, but that's typical for healed ridges. We took an impression to produce a provisional crown to be used 3 weeks later and did a non-submerged healing. You see the periapical. Then at 3 weeks, patient comes back, everything perfectly healed. ISQ is 83, and then the provisional restoration was installed. And then in 6 months later, then another reading was done. You see, the second molar has been removed, and then the implant has been restored in private practice by the referring dentist, and you see the 2-year follow-up. Here you see the 6-year follow-up of this implant doing extremely well, so it's no problem at all. So another patient you see here with initial reading of 80, non-submerged again, periapical. These are all tissue level implants with a machined neck, very important from my point of view. And you see then at 3 weeks 83. And you see then the 3-year follow-up implant is doing extremely fine. So in this study, we did more than 50 patients like this. And you see also 56 implants were tested. And you see we had no implant failures during the 6 months. So we had a 100% success rate. We had at 3 weeks 2 spinning implants at day 21 that required an extended healing period. ISQ values were helpful to determine implant stability.